To the growing refugee crisis, the UN Refugee Agency estimating more than 1.5 million people have fled Ukraine, many going into neighboring Poland. The longer this conflict rages, the more people will flee. Dr. Heather Papowitz with us now. She is with the World Health Organization. Dr. Papowitz, you're in Copenhagen. We know your heart is with the Ukrainian people. Many of these refugees are in need of medical care, from life-saving cancer treatments to insulin. What kind of help is on the ground for those with these kinds of health issues, and is it sufficient?
Yes, thank you. So yeah, as you said, there's a number of refugees coming over the border into neighboring countries, and they're actually leaving after having 2 years of health system disruption from COVID. So they're really coming in a very vulnerable state, as well as traveling for many hours in tough situation. So yes, they're in need of urgent medical care, as well as other supplies such as food and hygiene supplies. So they're really, really in need by the time they get there after such a long journey and after years and years of disruption.
That makes sense post-COVID, or hopefully post-COVID, as you just referenced. We have seen the images of those forced to stay behind, so hiding in basements of hospitals, recovering from surgery in some cases. There are many children. How dire is the situation? At what point does timing become truly critical for those who need care?
Yeah, so I think right now our priorities are really to save lives, like really urgent life-saving interventions, and to protect healthcare and health workers. We've had 6 verified attacks on healthcare and health workers, and we're in the process of verifying others. And among that, there have been 6 dead, 11 injured, and 6 healthcare workers among them. These attacks on healthcare and healthcare workers are a violation of international humanitarian law and a crime against humanity. These health workers are really, they're at the front line. They're providing healthcare in underground shelters and unsafe facilities, and they're risking their lives every day to help people in need. They're running out of supplies. There's lack of access due to insecurity. And again, as I said, they're already exhausted after 2 years of treating patients for COVID. So it's a really, really tough situation for the health staff on the ground.
So picking up on COVID again, there is potential alarm, no other word, in moving so many people, crowded train cars. I mean, we've seen these images. To what extent is COVID still a risk with so many people condensed, for example, in the trains?
Yeah, it is still a risk. So again, with the disruption in services, the prevention programs for COVID and for other diseases such as measles and polio puts the community really at risk of these infectious diseases. And for COVID specifically, the vaccine coverage within Ukraine is already low, and the disruption in services are making it difficult for people to have personal prevention methods, and then the access to healthcare. So if they do get sick, they won't have access to urgent healthcare. And we've had issues in this sense with the availability of oxygen. The oxygen plants already are low, and the supplies are also going low.
Dr. Papowitz, thank you so much for your time and lending us your valuable perspective.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.